Now to what continues to be the big story of the day and the year, the pandemic. Quebec has been hardest hit in Canada. There are now more than 34,000 confirmed cases in that province. That represents more than half the confirmed cases in the whole country. Quebec has also had the most deaths, more than 2,500 lives lost, and roughly half the people who have become infected in Quebec are in Montreal. It's also in Montreal where more than 1,500 people have died. So what is it about that city and the response that's led to this? Mike Armstrong is looking into that tonight.
This is the hottest spot for COVID-19 in Canada's hardest hit city. The rate of infection in the borough of Montreal North is about 50% higher than the next two closest hotspots. It is a densely populated, multi-ethnic area, and community groups want to know if those are factors. They're calling on the province to release data that breaks down who's been infected.
We call it social determinants of health. Factors such as race, income level, eventually even the family status.
Now, there are no hospitals in the area, so they've set up a temporary testing facility. What there are a lot of are healthcare workers, nurses, auxiliary nurses, and orderlies. One theory is that those occupations are a factor.
Probably we have healthcare workers and other essential workers that have contracted the virus and that have brought the virus in their families.
L'enjeu est dans la région métropolitaine.
Since the beginning, the province has called Montreal the big challenge. Things are basically under control everywhere else. Businesses have started reopening in other regions. Daycares and elementary schools reopen next Monday. In the Montreal region, everything will be later. 2 weeks for businesses, 1 week for schools, although that could move even further. But despite still struggling to flatten the curve, Quebec is pushing ahead as the only province or state in North America to bring kids back to the classroom. Well, one mistake Quebec is admitting it made is in long-term care facilities. In April, when other provinces were banning staff from working in multiple seniors' homes, Quebec health officials allowed it to continue.
They will wear masks and so they will not contaminate.
The province now says it wants staff to stay in one facility and not move around.
We're implementing this everywhere, and we want the organizations to follow this principle very strictly.
Now, testing is still a massive issue. The province has been doing about 7,000 tests a day. It's pledging to get that up to 14,000 by Friday. Mike Armstrong, Global News, Montreal.
More testing is key, and by this time tomorrow, Canada will likely have carried out its 1 millionth test for COVID-19. More than 970,000 people have been tested so far. The Chief Public Health Officer of Canada, Dr. Theresa Tam, says she would like 60,000 tests done every day. Right now, we're at less than half that, about 25,000 tests a day. That's why we don't have a full understanding of how many people have been infected. What we do know is the majority of tests do come back negative. Across Canada, about 63,000 people have now tested positive for COVID-19. More than 4,300 people have died. Almost all the new infections and new deaths are in Ontario and Quebec. Most other provinces and territories are reporting single-digit increases now or no new cases at all. Saskatchewan had 25 new cases today. There were 70 in Alberta and 23 positive cases reported in British Columbia today. And in BC, cases of COVID-19 have been on a downward trend for a while now. Today, Premier John Horgan announced plans to start lifting some restrictions. Global BC's Richard Zussman is in Victoria. Richard, what is the restart strategy in BC?
Donna, the big part of the restart strategy is a term being dubbed as doubling your bubble. So people will be able to expand their social circles by the May long weekend, but not too much. And every individual will be different. They need to assess whether they can expose their loved ones potentially to getting COVID-19. There also will be a concerted effort to start opening up more businesses, including a target to have restaurants open by the middle of May. It's a slow approach. Premier John Horgan says things like concerts and big events will not happen in British Columbia until there is a vaccine, and the priority will be around ensuring people have these expanded social circles.
As we start to relax some of the social restrictions, small social gatherings with physical distancing will be allowed. The choices you make about expanding your social circle will depend on your age, your occupation, and the health of the people that you live with.
A big part to all of this as well, Donna, is a slow, gradual reopening of the schools. K-12 will be reopening, but only on a voluntary basis. And there will be a number of new measures in place for schools across British Columbia, including health checks that will be conducted every day. People will not have to get their temperature taken, but they will be asked every day if they're feeling okay. There could potentially be phased classes, and also there will be enhanced cleaning in classrooms.
All right, Richard Zussman in Victoria, thank you.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.